So now I'm going to go into the patient's room. I'm going to perform hand hygiene. Good morning, Sid. How are you today? I'm here to administer your enoxaparin. Is that okay? Okay. I'm going to do an environmental check. So brakes, oxygen, any clutter. I'm going to check for the call bell. I'm going to raise the bed to a working height. I'm just going to put these down. Right, can I get your full name and your date of birth? And do you have any, can I see your wristband? Sid Garland. And your date of birth is November 8th, 1965. And do you have any allergies, Sid? And what happens when you have a reaction? Okay. And now I'm going to assess the site. So if I used the left side last time for his last administration, so I'm going to use the right side of the umbilicus. So I'm going to use 2 finger breadths or 2 inches to the right of the umbilicus. And I'm going to put on clean gloves. And I'm going to use an alcohol swab to clean the site, so 2 finger breadths. I'm going to start in the center and go outward circular motions. And I'm just going to let that dry for a minute before injecting. I'm going to use my injection pad. So once that's dried for a minute, I'm going to see how much skin I can pinch on my injection pad. So for this client, I can pinch 1 inch, so I'm going to inject at a 45-degree angle. So I'm going to pinch the skin with my non-dominant hand and hold the syringe with my dominant hand like a pencil. I'm going to pinch the skin, and I'm going to inject at a 45-degree angle. And I'm going to inject slowly, 1 milliliter for every 10 seconds. And I'm going to withdraw the syringe while still holding the pinch. I'm not going to massage the site. I'm just going to apply pressure for a moment. And then I am going to press up the safety cap until I hear a click. And then I'm going to dispose of my sharps into the sharps container. I'm going to remove my gloves and perform hand hygiene. And now I am going to provide health teaching. So Sid, can you report any symptoms of unusual bleeding, bruising, dizziness, difficulty breathing immediately? You cannot take any aspirin, naproxen, ibuprofen without consulting a healthcare professional before doing so. Okay, and then I'm going to leave my client safe and comfortable, and then I'm going to document on my MAR. Once I leave the room, I would document on the MAR for the 900-hour administration. So I documented the date, my initials. I left room for a co-signature, and the site is the right lower quadrant. So at this point, I would call over my instructor to co-sign this medication. And then I would be back to assess in